Hi, Eva here, registered dietitian who is passionate about using lifestyle changes to prevent and manage and treat chronic illnesses such as high cholesterol. In today's video, we will look at how to read your blood results, specifically your lipid profile results. So when you go to get your routine bloods checked, one of the things is a lipid profile, and it's a whole set of cholesterol levels and your triglycerides. And this is done to predict your risk of heart disease. And the common ones we look at are total cholesterol, so that's all your good and bad cholesterol combined, the LDL cholesterol, which is just one set of the bad cholesterol. Then we have the non-HDL, which is the non-good, so that means all the bad combined. And then lastly, there is a cholesterol ratio. So a common one that is used is your total cholesterol to your HDL cholesterol value, and the lower the number is, the better. And then, so I have the first example here. First out of 3 examples. The first blood parameter that is measured here is the total cholesterol. Now this is a combination of all of the cholesterol particles. It includes HDL and LDL. So if your bad LDL cholesterol is high, then this will bring the total amount up. It's not necessarily good to look at just your total cholesterol because it includes the good cholesterol too. That's why we measure all different types of cholesterol. So these blood results are actually quite nice to read because they are color coded. So we can see that the green results are okay and that the red mean that they are abnormal. And if these results were not color coded, we'd simply look at the result. So for the total cholesterol, it is 192 milligrams per deciliter. And if we compare that to the reference range, it is less than 200. So we know that it is in normal range. And we can also see that this person has a high LDL cholesterol. It's 121, but it should be less than 100. This person also has a high non-HDL cholesterol. So this is all of the bad cholesterol combined. It should be less than 30, but it is just slightly elevated at 135. So the good news is that their ratio of total cholesterol to the HDL cholesterol is actually less than 5. So it's in the normal range. And how we get that is divide the total cholesterol by the HDL cholesterol. So in this case, 192 divided by 57. So overall, because this person has a normal total cholesterol, a normal cholesterol to HDL ratio, and only slightly elevated LDL and non-HDL cholesterol, the risk of heart disease is quite low. But this person should probably start looking at some lifestyle changes to prevent these numbers from creeping up slowly over the next few blood tests. So this next example is a little bit more difficult to read because everything is black and white, nothing is color coded. But looking at this example, we can see that the total cholesterol is 310 milligrams per deciliter, and compared to the standard range for this particular lab, it should be less than 181. So this total cholesterol is high. Triglycerides here are within range. The HDL is within range. The LDL is elevated at 240. Non-HDL, so all the bad cholesterol combined, is high, and the cholesterol to HDL ratio is slightly elevated. So it looks like this person would need some guidance from a medical professional. And then on the last example here, the third example, it's color coded as well as giving us a nice visual representation of how close or far you are from a healthy range. So the total cholesterol, 165, it's in the green range, and it's under 200, which is the reference range here as stated. The HDL is lower than it should be, triglycerides are fine, LDL is slightly elevated, and the ratios are all in range. So the main issue here is a lower than normal good HDL cholesterol value. So lifestyle changes should do the job here. So all of the 3 examples that I have just demonstrated, the values are in milligrams per deciliter, and these units are usually used in the US. But if you're in the UK, Ireland, or Australia, for example, the units used are millimoles per litre, and the way you check your results is pretty much the same. It's just that the numbers will be slightly different and the reference range will be slightly different, but you can compare your value to the reference range, and then you will know whether something is abnormal or within range. I hope this information was helpful to you. As always, thank you for watching, and I will see you in 2 weeks.